Hi everybody, this is Loretta Jenkins from the State School-Based Health Center Program Office. We have a few more minutes before the webinar is going to start, so I'm just going to put us on mute and we'll wait for some other folks to join us. Hi everybody, we're going to get started in about another minute. I just want to give folks enough time to log in and get on the webinar. So I'll be coming back in just a minute or so. Thanks.
Start broadcasting.
All right, everybody. So I want to get started on the School-Based Health Center Operational Profile training. This is Loretta Jenkins, your friendly research analyst. And I want to start with a sound check just to make sure folks can hear us, because of course we can hear ourselves here. So if you can raise your hand and let us know that you can hear us. Yay. Okay, fantastic. Okay, so I'm going to go ahead and get started. Like I said, I'm Loretta Jenkins, the research analyst, one of the research analysts on the team. And normally this was Melanie Potter doing this webinar. And next year it'll be Derek Mills, our new admin, who's on our School-Based Health Center team. And so I'm just going to let Derek introduce himself so you can hear his voice. And then I've got another person in the room. She'll introduce herself.
Hi, I'm Derek Mills, Administrative Support at SBHC.
Hi, I'm Kavita Gavin. I'm the other research analyst on the Adults and School Health team.
Okay. All right, so we're going to go ahead and get started. We just have an hour for the presentation, and I've built in time slots for questions. So feel free to type in your questions into the chat box. And when we get to the questions slide, then we'll go ahead and read questions. After we finish the presentation, we're going to save down the webinar recording and post it on the our website, and as well as a copy of the presentation itself. So that'll be available, should be available next week. Oh, yeah, click on here. So it gives us that, yeah, there you go. Perfect. Okay, so our agenda, we've got a lot to cover. We're going to briefly talk about the School-Based Health Center Site Coordinator's role, what's in the operational profile, what type of staff need to be included and entered, if we've made any changes to the operational profile, which happy to report there were only a handful of changes that we've made, very few, helpful hints, and then also what our audit process is for after October 1st, which is, everybody knows it's their deadline to get everything entered. And then also just briefly talk about the operational profile user's guide that went out on the email that I sent. And it's also posted on our website. Great, so I want to talk about, no. Okay, actually not the right. Sorry, 1 second. I think it's got transitions, but I didn't know that it had them in there.
So we just keep pushing them?
Yeah. Okay, sorry about that. I'm actually not terribly technical savvy with fancy PowerPoint presentations. Okay, so here's the School-Based Health Center Site Coordinator role. You guys are responsible for managing the operational profile. Like I said, there's an October 1st deadline. We also expect the coordinator to update the operational profile as changes happen throughout the year. For example, changing in staffing hours, hours of operation, contact information, and that sort of thing. You're also required to fill out the required SBHC roles, attend coordinators meetings, and I think everybody has probably seen the announcements going out. We've got our October in-person coordinator meeting coming up, and then we have a webinar in the winter as well as one in the spring. We also expect the School-Based Health Center coordinator to communicate with partners like local public health authority, your SBHC staff, obviously the state program office. You're also ultimately responsible for submitting the encounter data that's sent into us twice a year in January and in July, as well as submitting satisfaction surveys, again, in January and July as well. So why do we have an operational profile? It's a required part of certification. It asks all kinds of information that it lets know that sites are in compliance with the certification standards. For example, staffing roles and shift hours, hours of operation, identifying the types of services that are provided at the School-Based Health Center, either on-site or by referral, KPMs, as well as the annual financial information. It also allows the School-Based Health Center Program Office to answer questions from legislators or partners regarding information like PCPCH status, how many of you all have youth advisory councils, and who has oral health providers, which is a great question we've been getting asked a lot lately. Okay, like I said, the time to fill out the operational profile, it's when you first have submitted your certification application for a brand new site. The School-Based Health Center Program Office will let you know when you need to fill out the operational profile. And then once you're certified, every year on October 1st, we expect all of the profiles to be updated. And like I said, that includes submitting key performance measure data as well as financial information. And that's required in order to remain a certified school-based health center. Also, as changes occur throughout the year, staffing changes, shift hour changes, general contact information, we also would like folks to do their best to update that as it occurs. And then also right before a certification site visit, there's another expectation that the profile will be updated for that time. So when your certification nurse comes out to do your site visit, they know that all the information So on our website, we have listed the link to get to the operational profile. It's also listed in the operational profile user's guide. And if for some reason you're having a really hard time finding it, you can always message our sbhc.program email, and we'll get you that link. We also have login information that we submit to you guys, that we give to you guys. We've assigned a login and a password that's used for your entire system. So if you have 5 school-based health centers, you have one login ID and password that you'll use to manage all 5 of those sites, which makes it a little bit easier. The login information does not change from year to year. So go ahead and bookmark that information somewhere, or if you can't find it, just contact us. Okay, so the profile of the structure of the operational profile. We have details that include obviously the county that you're in, the system and medical sponsor information, operations. We're going to go through a high-level listing here of the structure, and then we'll get into more nitty-gritty further into the PowerPoint. There's operations, staffing information, which includes individual staff, details like their email address, their shift hours, the shift hours for the entire school-based health center also, like I'd mentioned before, services that are provided, KPM entries, financial entries, and there's also a waiver tab that's there in case you guys have to submit a waiver. And we also have these accuracy confirmation boxes that are really important. You see the red arrow pointing to it. When you're updating the operational profile, there on each one of the tabs, you'll see one of these boxes down in the bottom right of the page when you're on the operational profile. Those are really important because that's the only way we know that you have gone in by October 1st and verified that all of the information on that tab is correct. Every year, usually it's mid-June, we go through the database and we have a button that we press that unchecks every single one of these accuracy confirmation boxes. So I had gotten some questions actually with folks saying, but I know I had checked my accuracy confirmation box, and this was in June, and I explained to them that all of those boxes are unchecked. That way we start fresh coming up on October 1st. We know then that you've reviewed everything. Okay. So as a reminder, when you're filling out the profile, the SBHC details, operations, staff, shift hours, and the services tabs all need to be for our current fiscal year that we're in, that started just this July 1st, that carries through to June 2019. The only data that you report on from the previous year is your KPM chart audits and your financial data. So kind of like when you submit the encounter data, that's always for the previous year. But important to understand the distinction that the details, operations, staff, and shift hours are for this current service year that we are in, 18-19. Okay, which staff to include? We want all staff who have on-site shifts at the school-based health center. We don't need the shift hours for folks that work in the health department, that have a relationship with the school-based health center. We only want folks that are working on-site at the site. So staff hours who are not used to meet certification requirements are also really important. Even staff whose encounter data isn't submitted to our office, we still want to know who they are, what their type of staff type they are, like we've got listed support staff, community health workers. And then also staff who work in the school-based health center less frequently than every week, we also need their information in the operational profile. A great example is dental providers. There are quite a few sites that have a dental provider that come in once a month or every 2 weeks, and we still need that information entered into the operational profile so we have the complete picture of who's working in the site. Okay, so now staff roles. So listed in the certification standards, you'll see all of these different roles here in front of you. We require that multiple people, hopefully not all of those, that there are multiple people that are going to be responsible for these different roles. Like I said, it's a requirement of certification. So by the time you're done entering in all your staff and your shift hours and putting contact information in, we would expect all of these roles to be populated by somebody. And you'll see also in there, there's license type and that sort of information that we also collect on the individual staff members. And if you need to look at more information and description about the different roles, you can look in the certification standards. They're on our website, or if you need a hand copy, a printed out copy, we can send that to you as well. Okay, I'm a fast talker, so we're already to the questions. If anybody has any questions, feel free to type them into the question box. A lot of this stuff, this initial stuff, is review for folks because it's just kind of the general information when we're talking about school-based health centers and the profile. And next, we're going to be getting into screenshots of the entries that you'll be making. And this is a great place for you to type in your questions because this is getting into the nitty-gritty for what you need to submit to us. So no questions, great. So we're going to go to the next slide. And I just want you to see the details tab. So when you guys log into via the web, the first screen for the individual school-based health center information, you're going to see all of these details. We need to know physical address of the school-based health center. Also, some sites have a separate mailing address. You can see in here the type of EHR you've got, if you bill third party, if you do electronic claims. All of the information that we have in here, we ask you to complete because we get asked these questions about our school-based health centers. So it's only as good as the information that you give to us. Next tab is the operations tab. And this is where you would put in your hours of operation, if you're open during the summer, and what those summer hours are. A really important section is the population served. We often get asked, well, are school-based health centers serving other schools? Are they serving an entire school district? So really pay attention to this information when you're filling it out. If nothing has changed since the previous year, then it's great. You don't have to make any changes, but definitely double check that. And down in the bottom right, I forgot to tell you on the first tab, but that's fine. Down in the bottom right, you'll see the accuracy confirmation box. That's what I was referring to earlier, saying you need to check that off and then put your name in there also, so we know that that tab is complete. Great, and now on to the staff tab. This tab will list all of the staff that are associated with your school-based health center. This will include folks that work on site and also that don't work on site. It'll allow you to go into that individual staff person. On the left side, you see 2 staff. That'll take you into the details of the individual staff member there. That's where you can add shift hours, if their email address or something has changed. That's how you would get there. But this is just a nice glance that shows all of the different staff that are associated with your school-based health center. If you need to create a new staff, you don't have to go back, no big deal. If you have to create a new staff, you would push the staff list button to reach that staff list. And this is what would pop up if you clicked on that staff button. Like I had mentioned previously, this is where you can see all of the roles, the different potential roles that that person would have, and then also their credentials and licensure. If you don't see a role or a credential that's on that list, feel free in the bottom where there's a red box at the bottom that says other roles and other credentials. Feel free to write those in there. If you have staff that are associated with multiple school-based health centers, if you look in the right side of the screen, it lists, this is our fake profile, our fake SBHC, but if they were associated with multiple sites, you would put all of those sites listed in there, in that little box. So if you have 5 sites in your system of school-based health centers and they were associated with 3 of them, that there would be 3 different school-based health centers listed there. Okay. Now here's one of the changes that we did make to the operational profile. When we were doing our audit last year, we realized that the way we calculated if a site was meeting certification standards and had the required number of hours, if folks put in an entry for somebody who didn't work every week in the school-based health center, it was calculating that. So if a staff was working only once a month, like I had mentioned before, dental provider, sometimes they only work in the school-based health center once a month, it was assumed that since it was in the system that it happened every week. And that's not the correct assumption to make because we know that there are folks that don't work every week. So we added an extra column called shift frequency. We were able to go back when we added this shift frequency column in and set everybody who is currently in the system, we set it, and they had shift hours, we set it to default to weekly. So when you go into the operational profile to update it, don't worry, you don't have to go in and make changes or add in the shift frequency unless, of course, they're no longer working every week. So that's, I mean, I know it's an extra step, but it'll really help us get more accurate and better information. So we'll go on to the next slide. Oh, we'll wait until we get to the questions. Oh, I don't know why it has a box there. Oh, hit it again, maybe. Hit it again. Okay, there we go. Okay, sorry about that, folks. Okay, so when you go to, let's say you have to add shift hours in for somebody, a row is going to pop up. You're first going to select the day of the week. And for any new shift hour, you're going to have to select if it's weekly, once a month, twice a month, or 3 times a month. And then you'll put in the start of their shift and the end of the shift. And you'll also have to select the school-based health center that that staff member is associated with. That you're going to get a box that's going to pop up and say shift incomplete. You can see that there in the middle of the big box. If you haven't entered in all of that information, you won't be able to navigate to another screen until you have put in all of that information. So it's a good check for you. But like I said, you don't have to go back to the previous entries you'd already made. They're already defaulting to weekly. So hopefully this change isn't painful. And again, if you needed to get into the shift hours tab for a particular staff member, on the left side, those yellow buttons, to staff, that's what you would click to then get into the details about the individual staff member. All right, and now onto the services tab. This is will carry over the information that you had entered last year, so it doesn't have to be recreated, re-entered. The only thing you would need to do is make changes. If there were services that you'd been providing by referral previously that now you're providing on site, please be sure to update this tab. And this one also has an accuracy confirmation box that will let us know that you've completed the information. Can't emphasize enough the importance of filling out that accuracy confirmation, because you're going to hear from Derek if you haven't filled out that box on any of these tabs. You're going to get an email from him asking you to go into the operational profile and either finish updating your information or fill out the accuracy confirmation. So this is really important for you guys to remember to do that. Otherwise, you'll be getting lots of emails from our office. Okay, on to the next one. Here's where we have the certification waiver tab. If for some reason you're out of compliance with our certification standards, you would go into the certification waiver tab and you would hit add waiver is what you would do, and then it would pop up with a screen where you would then enter in all of this information, your name, your title, your email, whether or not you've notified County Public Health that you're submitting a waiver to us. Also, there's a section for what part of the certification standards you are not in compliance with. So you need to, that's important to include that in there. And then also explain why the standard isn't being met and your action plan for when you expect to be able to come into compliance, and also a date. After you've done that, you hit the submit button. We automatically get an email letting us know that a waiver has been entered into the system, and then we will get back to you after we've reviewed it as a team. We pretty much review all waivers together as a group, and we'll let you know if there need to be changes to the plan, if we've got questions about any of it or the expected completion date. We'll get back in touch with you for that. And now time for questions. Great. School districts that serve all districts in their county. We just want that information documented in our database, so when folks ask us, so how many total school districts are served by school-based health centers, we can give an accurate count of that. So please, please fill that information out to the best of your ability. There's another one. A lot of questions. Let's make this bigger. Yeah. Okay. Okay. We're going through the questions. 1 second. Go down. Okay. So would we include community partner organizations that are co-located in our school-based health center in the operational profile? I mean, if you consider them to be part of your school-based health center and you work in conjunction with them and they refer clients to you and vice versa, yeah, that's really important, useful information for us to have. And if you have, you know, real specific questions and you want to talk offline, just feel free to send an email either to your assigned public health nurse, which is either Karen or Rebecca, or just an email to the School-Based Health Center State Program Office. I tend to err on the side of give us as much information as you think we need, and if for some reason we don't need the information, we'll let you know. Okay, the next question, can coordinators now delete staff completely, or do we still need to ask the SPO to delete staff? So the way the database is set up, there are a lot of different places that the staff need, information about the staff need to be deleted. And if we just were to give, I actually don't think it's possible for folks in the field to entirely delete a staff member. It's, you know, my understanding is it's because it's in several different tables in our database. So what we ask you guys to do is go into that staff member, their shift hours. First, you need to X out and delete their shift hours. And then if they are no longer associated with any of your school-based health centers, you'll then also X out the SBHC that's listed that they're associated with. And that's when you then notify our office. And then we go in and on the back end, delete them in a couple of other places that you guys can't see, that you don't have access to. What I really would encourage you not to do is to delete somebody's name and write in a new person's name. We would really prefer you create a brand new staff member, even if they're taking over that person's position entirely. It's just easier from a database management perspective if you just add a brand new staff member. And it's listed in the operational profile user's guide that the steps that you need to take. And I mentioned them. First, you delete the shift hours, then you delete the school-based health centers they're associated with. If you don't do those steps, it creates kind of weird entries in the operational profile on the back end that makes things complicated for us. So if you are a real visual learner and you need to look at the user's guide to understand what I'm talking about, look in that. We've got the steps listed out for how to delete somebody who's no longer working at a site. And then if you have questions, just send us an email to the SBHC program office, and because that is one of the trickiest parts. It even stymies us sometimes trying to figure out why things look the way they do for staff members in particular in the database. Okay. To confirm, we do or do not need to enter shift frequency for existing staff hours. You do not need to enter shift frequency for existing staff hours. We were able to, when the programming for that shift frequency column to show up in the database, we defaulted everybody who had a shift hour to be weekly. There were, like I've mentioned several times, there are some sites where there was a dental provider, and down in the box for that dental provider, it was written in, they worked these hours once a month. So they didn't have a shift frequency. That's not an issue for them because they didn't have a line item assuming they were working weekly hours. So you'll see that when you go in, if you do have a circumstance like that where you've got a staff member who's not working every week, you'll go into that person and you'll see that there isn't an entry, a current entry for them for their shift hours. We need you to go in, add a shift hour for them and indicate if it's once a month, twice a month, or 3 times a month. And if you have additional questions on that, please feel free to send us an email to sbhc.program. That's the best way for us as a team to kind of farm out who replies to which questions. So who do we contact when we need to remove staff off the staff list? And it's easiest to send it to the sbhc.program at state.or.us. That's where we encourage folks to, if they don't have a specific person that they know they need to contact, just to send it in to that email address, and our entire group will get that and see that email.
Some questions.
Okay, awesome. All right, on to the next. And again, just feel free to type in your questions as we go along. Okay, so the KPM tab, we did make changes on the KPM, and it's basically, it locks out folks' ability to create a new KPM entry until they have submitted to me, until the site has submitted to me their chart audit tracking sheet and their audit process document. So once you've submitted those to me and I've reviewed them, I either reply with questions or I will let you know that you're complete and you can go into the profile and create a new KPM entry. It's basically a lock on our side because it will prevent me from having to go back and have you all redo your audit, change your process, and resubmit information. I really encourage folks to submit their audit process document to me before doing their chart audit. Because if there are changes that have to be made, I would rather save you guys the time and energy and help you understand why the process you are going to use for auditing your charts isn't accurate. And that's really, I mean, you obviously don't have to submit it to me first, but I would encourage you to do so. And now I'm going to talk. That's just, I wanted to mention the change. Now I'm going to talk a little bit more about the KPMs and where to find information on them, but I wanted to get that change out there first so you guys could understand that if you wait until October 1st to try to do a KPM entry and you haven't submitted me the required documents, you're going to be locked out and unable to make that change until I've reviewed and approved your documents. So on our website, on the data requirements portion of our website, we've got all of the documents that tell you what codes to look for when you're doing your chart audit, yeah, who knows?
Go to the next one.
Nope, not yet. So they're posted on our website, and if you have any questions after reviewing the guidance documents, please don't hesitate to contact me sooner rather than later. We have some FAQs in there on each guidance doc, and it's really important for when you're setting up your chart audit process that you take into consideration exclusions, who the eligible population is, and what you're looking for in your chart audit. So each SBHC needs to audit 20% of the charts from the eligible population. We've got a minimum of 30 charts and just a maximum of 50. So if 20% of your charts is 250 charts, goodness, heaven forbid, you don't have to audit 250 charts. 50 is the max. If you need help with figuring out how to calculate how many charts you need to audit, just please send me an email. The same charts can be audited for multiple measures, and this is really important, as long as the eligible population is the same. The only 3 measures that have the same eligible population are the well visit, the health assessment, and nutrition screening. Those are the only measures that are over the entire population 5 to 21 years old. So please double check the optional measure guidance document to make sure you are auditing the correct age range, the correct criteria, because again, it'll just save you time. And don't hesitate to contact me with questions. So again, the 2 documents that are required for me to review before you can create a KPM entry are the chart audit process summary and the chart audit tracking sheet. Like I said before, the chart audit process explains the steps on what you're going to do in order to select the charts for your audit and what kind of criteria you're looking for. The chart audit tracking sheet is either an Excel document or a table of some sort. You have to put down a patient ID so you can track back to see if we need to have you look at a patient's chart. For some reason, if I'm confused about a result that you've submitted to me, you don't have to submit actual patient ID or medical record numbers to me. You can submit a dummy patient ID, but I want you to be able to go back to look up that particular patient if for some odd reason I have a question. That I don't think that that's ever happened, but we just want folks to keep track of that for documentation purposes. Okay, here's a quick look, a screenshot of what your chart audit tracking sheet could look like. We have listed on our website a link to a blank document tracking sheet, and then I also have created one that has this kind of dummy data entered into it, so you can download those to your computer and you can check them out and ask me questions if you have any. So as a reminder, if you are submitting actual patient IDs or medical record numbers, they need to be submitted via secure email. If your email system doesn't have an easy ability to initiate a secure email, just send me a note and ask for a secure email so you can submit those documents to me. And another thing for the folks that chose the immunization measure, the adolescent immunization measure, you need to submit to me a spreadsheet with the name, date of birth, gender, race, and the kiddo's address, because the immunization program looks those clients up in the alert program to see if those kids have had the adolescent immunizations that we would expect them to have. So you aren't doing a chart audit for that immunization KPM. The alert program will do it for you. And obviously that does need to be submitted via secure email since it has patient names on it. All right, and now here real quick, this is how, once I've unlocked the KPM entry, you'll be able to go in and add a KPM, and here's the information that you'll need to fill out. You'll need to fill out the fiscal year, the service year, so that would be the 2017-2018. You want to put in the number of charts that you reviewed and the number of charts that were in compliance. It should never be more than 100%, or else you're doing something magical there. Down at the bottom, you need to check the boxes that you did submit the audit process and the audit tracking sheet and include your name. And if you've got any comments that you need to put in there, feel free to do so. And then press that KPM confirmation button saying that you've completed that and it's being submitted to our office. Does anybody have any questions? Where you will include a patient ID number. Each one of the measures is going to be listed. So one column would be the well visit, another column would be the health assessment, and then the third column will be whatever optional measure you've chosen. I also encourage folks to include a comment column if they want to write in some information either for themselves or for me. And on our website, we've got listed the documents that you need to submit, like I said, a link to an Excel document that you can use for your tracking sheet. And if you have additional questions for me about the audit process and the steps that you need to go through, just email me directly. And again, this is Loretta, and we'll get you on track. No more questions?
No more questions.
Okay, great. Now I'm going to turn things over to Sarah, and she's going to talk about the financial revenue.
Hi, everyone. This is Sarah Nipper. I'm the epidemiologist at School-Based Health Center office, and I am just going to take a few minutes here to walk folks through the financial tab. Officially, we haven't made any changes to this tab since last year, but I've worked with a lot of you and a lot of folks in your systems on developing some financial reports, and so I want to spend a few minutes talking about some things that people have gotten confused about. I've noticed over the past couple of years, and just hopefully to make it smoother for you and clearer for you as you're entering your data. So when you're going in, you're going to be entering your revenue for the School-Based Health Center for the past fiscal year. So you'll be doing 17-18. So you just hit that select button, and you can see on this one it shows you like all the past entries, and then it'll pop up the summary of whatever you've entered so far, so you can kind of get a sense of what it is. If you're doing a new one, you're gonna click on that Add Annual Revenue tab, and then that's gonna kind of get you into a new entry for this year. Okay, so once you get in there, this is the first page you're going to see, and there's a couple of things that just to pay attention to right off the bat. So one of the most important things, and this is something I've noticed a lot of people are forgetting to do, is to put a contact person up here, either whoever has entered the data or whoever has given you the data to enter. So basically, if I have questions about the financial data that got entered, who do I call or who do I email? So please, please, please put that information in there, and it'll make your life and my life a lot easier. And then you just want to make sure that you're working on the correct fiscal year, the 17 to 18, it should say, for this year. Go ahead. So there's 3 tabs up here. This first tab is the Public Funds, Grants, Donations tab. So this first box here, this revenue source breakdown, this is all the public and medical sponsor funds. So we have space for federal funds, like if you got HRSA dollars or you $330, you go ahead and put that amount in there along with just a brief description of what it is. Those federal funds, that does not include billing. This would just be some other source of federal funds. So like if you bill Medicare, that goes on a different tab. This is just for like federal grant funds and that kind of thing. Under state funds, this is where people, I have noticed, tend to get confused, especially systems. If you're an SBHC that's not run by the county, but you're run by somebody else. So under the state funds piece, what we're looking for here, the SPO-based funding, is basically your certification dollars. So this, to you, kind of might look like county funds because it comes through the county, but it's the money that you get from us for being certified. So whether that's, we fund the counties at $60,000 if there's one SBHC, or about $55,000, $57,000 if there's more than one SBHC in a county. And we know in some cases that, the medical sponsors might not get all of that money, so we're asking you to report on what actually came into the SBHC. But those are state dollars, so make sure they stay in the state column, not down in the county column. So that's the base funding. And then, I'll keep going. Yeah. Okay, and then the SPO mental health funds, this is state mental health expansion funds. So if we're funding you, which pretty much almost every SBHC, we are funding you to have a mental health provider in your SBHC, we want those funds in there too. And again, we know how much we allocated, but sometimes a little bit of the money might stay with the county or it might stay with the mental health agency. So we want to know what actually went towards the SBHC. Okay. And then, oops, sorry, go back one more. Okay. And then just the rest of these. So if you got actual county funds that were county dollars, like county general fund, I know a couple of you are fortunate enough to be in that position. That goes there. School district, medical sponsor, city, et cetera. And then on the right side are any grants or fundraising or in-kind donations, and it just a brief description, especially on the grants, just who the grantor is. If it's you got a Hallways to Health grant or Northwest Health Foundation or something, just you can put those in there. Okay. All right. The next tab is the fees and billing tab. So on the left-hand side, this is patient fees, so co-pays, if you collect sliding scale fees, any sort of SBHC registration fee, that's where that goes. On the right-hand side is the third-party billing, and we've divided, as of last year, we divided this up into 2 sections. Okay, one more. Oh, one more. Okay, so we've divided it up into mental health, which is on the left-hand side, and then everything else, which is primary care, physical health, dental health on the right-hand side. I know this gets complicated for those of you who have a separate mental health agency providing your services. We ask, both for this and for the last screen where we ask on the mental health money, the state expansion funds, we really ask you to work with your mental health partners to get the information to populate this. So this is billing revenue that goes back to support the SBHC in some fashion. It, whether it's to support provider time or just going to general operations, whether for the mental health, maybe it just, the grant doesn't cover all the costs of providing those services, so the billing goes back to that. I know there are a few of you with mental health partners that the mental health agency, their costs are covered by the grant, but they also keep the billing money, which is unfortunate. I know there are a few of you in that position. In that case, you would not enter the billing money here. This is revenue that goes back to support the SBHC. For most of you, you have mental health billing money, or your mental health partner has billing revenue that's going to support the SBHC. So we want OHP, fee-for-service, OHP, CCOs, private insurance, and other third party, which could be like Medicare or CHAMP VA or something like that. So that's on the mental health side. And then on the primary care side, or the other, physical health side, you'd enter the same thing. We also ask for C-Care. So we want the total billing revenue for the year for your SBHC clients. And then we also ask whether this amount includes any per member per month or incentive payments, basically anything beyond a fee for service. So if you get a capitated monthly payment from your CCO, even if it's for a portion of your clients, then you would mark that yes radio button for that. You know, for the most part, C-Care and fee-for-service OHP, you would get pretty much straight fee-for-service. But on the CCOs, on the private insurance, on the other third party, we just want to know broadly if you're getting anything beyond, which I know a lot of you are, anything beyond a fee-for-service encounter-based payment. So again, work with your mental health agency and your sponsors to the best ability that you have. If you are comfortable giving them the login and they can enter it themselves, that is an option. If you are having a lot of trouble getting their participation, feel free to reach out to me. Again, this is Sarah Nipper, or you can email the SBHC program. Sooner rather than later would be great, because I had a lot of sites just leave it blank, and they were like, I don't really know the answers. And then it takes a lot of tracking down to kind of circle back and get everybody on the same page. So do the best you can. And then one more, just a note on the billing revenue. So if you can, these should be adjusted charges. So whatever your charges is minus the adjustments. If it's not possible, you can go ahead and enter payments, but we're hoping to get adjusted charges. The last thing I'll say is we are asking for this, like everything else, at the SBHC level. I know, especially on the mental health side, but really for any of the billing revenue, for some of you, you don't break your billing down that way. You might only be able to give it to me at a system level. I want you to do the best you can, but if it's not possible, if you can only do it at a system level, just send me an email and let me know, and we'll figure it out. But yeah, just do the best you can. So that's the billing piece. And then the last tab, just if there's anything else, any other funding, for those of you who have in the past entered your, if you're an FQHC and you're participating in the statewide APM, some of you have taken this spot to enter your FQHC APM or your PPS dollars here. This is a great place to do that. I really appreciate it. And so if that's you, if you have dollars that you get from your FQHC APM or PPS payments, if you go ahead and enter it here, that'd be great. And then in the notes, you know, put anything that you think needs explanation. For example, this year, we had a county where they get county funds for their mental health, but not for their primary care. So we have dollars in the county entry, and they just put a note here saying those county dollars are actually just for mental health. Anything like that is really helpful. And then on the right, you can see kind of a summary of what you've entered so far. Those totals are all automatically calculated for you. One more. Yeah, keep going. Oh yeah, I already talked about that. Okay, keep going. And then once you're done, we want you to submit this button. You've filled out all your financial information and it's complete. Go ahead and submit so that we know that you're finished basically, and it's all done. And then we can take a look at that information. So if there's anything that I can just like leave you with here, it's please don't forget to put a financial contact person in there. And please, please do your best to work with your mental health partners, for those of you who have a separate mental health agency that you're working with. And that will make everyone's life a lot easier. Thank you so much. Questions? Okay. All right. Do the YAC funds go into the SBO mental health funds? Yes. Good question. YAC funds are included in the mental health funds. Yes. If we have more than one SBHC, should we report half of the funds in each SBHC? Well, it should be kind of however it is. So like if you evenly fund your SBHCs, like I know there's one county out there that has 2 SBHCs, and they go about 75-25% as far as what they use their state certification dollars for. So when we get the report, even though we fund them at 110,000, one SBHC is reported at like 75 and the other one at 40. You know, again, if you don't really calculate it like that, yeah, go ahead and divide it by 2, but be as accurate as you can. Is that it? Oh, if the school district is holding the grants and we bill them from those grants, does the funding go under the school or grants? If it's school district dollars, then it would go under school district. If the school district applied for a grant from somebody else, which I think maybe is what this question is asking, like, I don't know, the school got some funding from, like, some federal funding somehow, and that the SBHC is tapping into that, then it would go under federal funding. If you have questions about that, more questions about that, feel free to contact me offline.
Yeah.
All right, great, thanks.
All right, now we're wrapping things up. We've got some helpful hints. When you're in the operational profile, don't use the browser's back button. Do not do that. It'll kick you out. You'll confuse the system, actually, and you'll probably have to log back in. Just go ahead and get so all of that stuff displays. Any changes you make are automatically saved. You do not have to go and hit a save anywhere. It's a live update, if you will. So that's why you also have to be careful for things that you delete if you didn't mean to delete them. Be sure to check all of the accuracy confirmation boxes, because Derek will be getting in touch with you, reminding you you need to go in and do those. So please do those by the end of day, October 1st, so there are fewer emails going back and forth. Make sure all of your staff information is accurate. We need email addresses. We need their correct shift hours. Please use Chrome, Safari, Edge, or Internet Explorer when you're accessing the operational profile. It won't work with Firefox in particular, and that's what we have here at work, so we had to get exceptions to get other browsers to be able to run the operational profile. Make sure all of your KPM percentages are at or under 100%, because that's magic you can't do. On to the next one. Oh, questions.
Thank you. Just
okay. Okay, the operational profile audit process. Beginning on October 1st, we're going to review first to make sure all of those confirmation boxes are checked. We're going to make sure that you've got the minimum operating hours, that you're meeting our certification standards for all of those things, that a KPM entry has been made, and that a financial entry has been made. Derek will be notifying you on that initial check if those things aren't all completed. The next one I've referenced is the Operational Profile User's Guide. It can be found on our website. It's really great screenshots, just kind of like how this PowerPoint presentation was. Lots of detail, step by step. We've really tried hard to make it as user-friendly as possible, but always feel free to check in with us if you've got questions. Here's our contact information, our sbhc.program email that all of our team gets, every single one of those emails. So when all else fails, send an email to the SBHC program and we will get back to you as quickly as possible. Please do your best to not wait until October 1st. Can't say that enough. Inevitably, there will be some funky thing that you run into that you need to touch base with us on. And it makes everybody's life simpler if we get to October 1st and you've already asked your questions and you know how to fill out all of the information. I am going to say really quick that we being the state, has been having some problems with our FileMaker server. We aren't the only program who uses FileMaker here at the state. And there have been issues with logging into the operational profile. The state has been looking at it. I think it's been well over a month. The problem is intermittent. It can work for one person and not work for another. If you log in and you get an error message, our state data folks have said, try the refresh button on your internet browser, X out of the internet, open it back up. And like I had an issue this morning, 4 times I had to try to log in and it finally logged me in. We here in our office obviously don't know what's happening, and unfortunately the state server folks don't know either. So please do your best to not wait too long to work on getting this information in. So in case you're having hiccups, it doesn't slow you down. The other thing I would say is when you log in and you're entering in information and maybe you have to go and get some information from somebody else, leave your browser window open. It's not going to hurt anything. That also then decreases the likelihood that you're going to get a weird error. Any last questions? Please feel free to contact us. You know that we're here for you guys. Really appreciate your time. Hopefully we'll be seeing a lot of you at our October in-person coordinators meeting. And I guess we're going to sign off. We're going to be posting this in the next week or so along with a PowerPoint presentation, and we're here to answer questions. So thanks everybody.